Hello everyone, Ed Darling here, faculty at SUNY Upstate Medical University, Department of Cardiovascular Perfusion School in Syracuse, New York. Thank you for being a clinical affiliate and thank you for partnering with us to train the next generation of perfusionists. Today I want to briefly go over the CPB case evaluation. Case evaluations are nothing new in perfusion education and training. We've all, as students, been evaluated on during our cases, and the purpose of them is pretty clear. They provide expert feedback and assessment to the students. They also allow us to track the progression of skill and concept acquisition and to identify any gaps in didactic knowledge or clinical performance or professionalism that can be remediated. And ultimately, it's to ensure that we graduate competent entry-level perfusionists. So we use the case evaluation tools to provide these assessments. But what's in it? Well, there are skills, both technical and non-technical. Technical skill would be initiation of cardiopulmonary bypass. A non-technical skill would be communication. Recently, there was a publication that came out that actually categorized the fundamental skills of adult cardiopulmonary bypass. So skills can be evaluated in isolation, the skills that make up a bypass case. But there are also elements to evaluate. How well does the student understand the concepts? How well is the learner with the data synthesis and situational awareness and the context of the operation? So all of this should also be in a case evaluation. So let's look at the SUNY case evaluation. It attempts to provide an objective way to measure the skills of bypass and some of these other attributes. And it's based upon the Dreyfus model of skill acquisition. Basically, this model shows 5 phases in which a learner acquires skill. Now, you're the expert. You're here. What we would like our students to do is to advance to this level so that they are performing at a competent or a proficient level when they graduate. We would consider this an entry-level competence would be in these 2 categories in the Dreyfus model. So let's take a look at a sample section of a case evaluation. And you can see here under the initiation of CPB, there are some radio buttons. You can select not applicable, proficient, competent, novice/beginner, or unsatisfactory. Now let's add some definition to these selections. What's going to guide you in making the assessment that initiation was a novice beginner or a competent or a proficient level of performance? So this is a key that we can use to help guide us in our assessments as we fill out the case evaluation. We've combined the advanced beginner and novice. We have the competent, proficient, and unsatisfactory. Each one of these phases can be evaluated based on knowledge, the execution of the skill, the autonomy, how well the student coped with complexity, and the perception of the context. The unsatisfactory category is if a student did not or could not perform the task, or a critical unsafe act or error was committed, or perhaps it's a repetitive deficiency. The student repetitively omits a step, and over time it moves into this unsatisfactory column. Let's go ahead and take a look in Medatrax at the student case evaluation. Now the student will invite you to do a case evaluation. So you will get an email which will take you to a link into the Medatrax. You'll sign in and you will have an evaluation that is waiting for you. Now here's how it will look. You'll see the score key located at the bottom of the evaluation. So again, that's going to, if you go all the way down, this gives us the guidelines for assignment of the assessment levels that we're going to give. The student will fill out all of this. This will come to you pre-filled with the date of the procedure, the surgeon, pump time, and they'll also provide you with some text that will bring to mind the procedure that you were the preceptor with them on. It's a fairly typical case evaluation. You can see we have the pre-bypass elements, circuit priming and setup, patient history, calculations, the use of RAP or VAP. Then after the performance, initiation, use of vacuum, assessment of good bypass, hemodynamic management, performance of laboratory analysis and blood gases, anticoagulation management. And then if they face any of these, again, not every case will you use any of these cerebral perfusion techniques, so the NA is available. Not every case will have these challenges like portovenous drainage or management of venous air or management of high arterial line pressure, but if they do, you can evaluate how that student responded. The weaning and termination of bypass. Any other comments regarding the conduct of bypass can go here. Then in the post-bypass phase, their awareness and vigilance after they come off bypass to the patient status, how well they manage the autotransfusion operation, and perhaps circuit salvage. If you needed a balloon pump, if they were involved in that, that can be evaluated. If they had to urgently go back on bypass, again, all of this can be evaluated. If you had to put an ECMO in, how well, if they were involved in that ECMO setup and initiation following bypass, that can be evaluated. And finally, there's the professionalism category. We look at overall communication, and then we've got a category of communication during adverse situations. Perhaps the surgeon is yelling at the student. How well do they handle that? And then some of the intangible but very important professionalism attributes: punctuality, attitude, disposition, teachability, receptivity, criticism, compliance to standard precautions. We break away from the Dreyfus model and we use a scale of exceptional, satisfactory, unsatisfactory, or unacceptable. Again, at the bottom of the evaluation is the guidelines, the key to help guide you in making an assignment of proficient, competent, novice, or beginner, or unsatisfactory. All can be found at the bottom. I think there will be a learning curve in understanding these categories, but I think after a few case evaluations, it will become second nature. But we really do seek your feedback. If there's things we need to add or subtract in this case evaluation, please let us know. We can make changes. Thank you once again. Really looking forward to this upcoming first rotation. Look forward to talking to each of you. And again, thank you and thank your team for their contribution to perfusion education.